Today we are talking about something extremely important for every person who uses any kind of medicine, and that is the real meaning of prescription strength and how this strength decides whether a medicine will help you heal or not. Most people take medicines but never understand what makes one medicine powerful and effective while another medicine barely works. Prescription strength is not just a label, it is the exact amount of power inside a medicine that your body actually needs to fight a condition, recover from pain, or balance a health problem. In this complete video we will explore how prescription strength works, how doctors decide it, why it matters, and what really happens inside the body when you take the right or wrong strength. Prescription strength means a medicine that is designed with a specific measured therapeutic power. This power is decided after years of medical research, clinical trials, and safety checks. Doctors choose this strength by studying the patient's age, weight, medical history, kidney function, liver function, and even the severity of the disease. Every medicine has multiple strengths available, but only one strength is the right one for a particular patient. That exact dose becomes the prescription strength for that person. If the strength is too low, the medicine will not work. If the strength is too high, the medicine may cause harm. This delicate balance is what makes prescription strength a science. When you take a prescription strength medicine, your body starts absorbing it through the digestive system or bloodstream. Depending on the form the medicine reaches, the bloodstream then spreads to the target organs where it begins correcting the imbalance, reducing inflammation, killing harmful bacteria, or restoring natural functions. Every medicine has an active ingredient, and this ingredient has a required concentration level. If the medicine does not reach that concentration level inside your blood, it will not create the expected effect. Doctors know how much concentration is needed, and that is why they adjust your prescription strength carefully. Many people assume stronger medicines are always better, but that is not true. A powerful medicine taken in a stronger dose than needed can cause reactions, unwanted symptoms, and long-term harm. This is why even simple painkillers have prescription strength versions. They work faster, stronger, and more accurately, but only when the patient needs that strength and only when a doctor guides the dose. For chronic diseases like diabetes, hypertension, thyroid disorders, or severe infections, prescription strength becomes even more important because the wrong strength can delay recovery or disturb the body's natural systems. Infections are one of the biggest reasons doctors prescribe specific strengths. Antibiotics, for example, require a precise dose. The bacteria inside the body need to be exposed to a certain strength for a certain period. If the strength is too low, the bacteria survive and become resistant. If the strength is correct, the bacteria break down and the body heals. High blood pressure medicines also depend on exact strengths. If the dose is lower than needed, the blood pressure remains high. If the dose is higher than needed, sudden drops in pressure can occur, causing dizziness, weakness, or fainting. Pain relief medicines also rely on prescription strength, especially in cases of injury, surgery, arthritis, or nerve damage. The doctor decides how strong the medicine should be. The body responds differently to painkillers based on metabolism and tolerance, so one person may need a certain strength while another may need a different one. Similarly, asthma medicines, depression medicines, anxiety medicines, heart medicines, and allergy medicines all have multiple strengths because each patient's body chemistry is different. The importance of prescription strength also becomes clear when we talk about children. Their bodies absorb medicines faster and react more strongly. For this reason, doctors calculate exact strength based on weight and age. For elderly patients, the opposite happens. Their organs process medicines slower, making them more sensitive to higher strengths. Therefore, doctors reduce the strength and keep it safe for them. This careful balance protects the body from side effects while making sure the medicine still works properly. Prescription strength also prevents overdose. Overdose does not always mean a very high amount. Sometimes even taking a little more than your required strength can overload the liver, kidneys, or heart. This is why prescription labels include the exact milligrams and timing. Taking medicine at the wrong time or mixing it with certain foods can also change its strength inside the body. This is why doctors guide patients about timing, avoiding alcohol, avoiding specific fruits, or drinking extra water. Whenever you receive a prescription, it is not just a piece of paper, it is the exact plan created after understanding your body and your condition. Prescription strength ensures fast relief, safe healing, and reliable results. Without it, medicines become unpredictable. That is why self-medication is risky, because you never know what strength your body actually needs. Even herbal supplements can interact with prescription strength medicines, changing their effect, which is why consulting a healthcare professional is important. Now let us look at what happens when prescription strength is ignored. When a person uses lower strength than needed, recovery becomes slow, the disease may worsen, and the medicine may fail completely. When a person uses higher strength than needed, the body experiences stress, irritation, or internal damage. In some cases, it leads to long-term complications. The right strength, on the other hand, strengthens the immune system, stabilizes vital signs, reduces symptoms, and helps the body repair itself in a safe, controlled way. Prescription strength also helps in long-term treatments. For example, in thyroid disorders, doctors adjust strength every few months because the body changes and the medicine needs adjustment. In diabetes, doctors adjust insulin units because each body responds differently. In mental health treatments, doctors increase or decrease strength slowly to avoid reactions and reach the perfect balance. Prescription strength is a journey, and the doctor is guiding every step to help the body stay healthy, strong, and stable. Everything inside the body works on balance, and medicines must respect that balance. That is why prescription strength exists. It keeps your healing safe, your recovery fast, and your organs protected. So whenever your doctor prescribes a specific strength, remember it is made for your body specifically, not for anyone else. Never share prescription strength medicines with others, and never use someone else's medicine even if symptoms look similar. Each body has its own chemistry and its own required strength. With this complete understanding, you now know how important prescription strength is and how it protects you, heals you, and guides your recovery. If you want to live a healthy, balanced life, always follow the strength your doctor recommends and avoid guessing your own dose, because small mistakes can create big problems. Take care of your body and let the right strength support your healing journey. Thank you for watching this complete video. To support our work, please like, share, comment, and subscribe to our channel Health vs Natural Bites.